Well, let's take a closer look at how the U.S. healthcare system is handling the COVID-19 pandemic with David Ding. He joins me from Newark, New Jersey. David is an assistant professor and director of the Healthcare Services Management Master's Program at Rutgers University. Thank you for joining me.
Thank you, Rachelle.
So what are your thoughts on the U.S. response in terms of securing personal protective equipment, or PPE?
It's a good question. So coming from supply chain standpoint of view, I think there are two different aspects to answer this question. As you mentioned in the news, that White House has been negotiated a deal with foreign countries, including China, and last week. And so we're expecting over 23, including the one arrived in New York yesterday, 23 airlift PPE equipments to the United States over the next 2 weeks. That really helps help the situation. And the second one, from domestic standpoint of view, FDA, which is a leading agency right now, that's taking steps to increase the supply of PPE. So first of all, they lift the requirements for N95. So previously, N95 needs to meet very stringent requirements from FDA in order to be used for healthcare professionals. Now, they're saying as long as those N95 meet the standards set by the National Institute of Occupational Safety and Health, then it can go with a healthcare professional. So if we take a 3M, which is the largest manufacturer for N95, for example, they produce N95 at the capacity of 35 million per month. And prior to this change, they can only supply up to 5 million to healthcare professionals.
Right.
So I think this really very timely change. And as New York governors also called for collaboration across different hospital systems in tri-state and even across the nation, I think that is really coming to play. And also, we see there are a lot of ER settings, such as the dental office, are sharing the PPE. And we're also seeing some other industries, such as construction industry, are sharing the PPE as well. So that really helps. And the last one, I think, from a domestic standpoint of view, is that the FDA recently published regulation regarding how to take extended use or even the reuse of masks and gowns. And they also published regulation in terms of how to use expired masks for non-surgical purpose.
So, David, you raised an interesting point. I mean, you mentioned there's obviously a lot of impetus to get this protective gear and the test into the hands of those who need it most as fast as possible. So how are quality controls keeping pace with demand?
That is another good question. I think what we can do right now is not to think about what we cannot do, but rather to think of what we can do. And so I have a lot of students in my programs coming from physician and nurse practitioners, and we just have a first virtual meeting last week. And we shared a lot of comments, and I think what they need right now is really to have access to the equipments. And even though that we do not have the timely quality control in the first place, but as long as those equipments meeting the minimum requirements set forward by FDA, I think that should serve as a protective purpose.
So then talk about the importance of bringing down the cost of some of these personal medical supplies and the cost of testing for the public.
Yes. I think in terms of, so I'm coming from a business standpoint of view, right? And so in order to reduce the cost, a lot of times we need to talk about the new technology. And we also need to talk about the economy of scale, which means as long as so for instance, New Jersey is the hub for healthcare and for pharma industry. And so we have a lot of resources over here. If we can really take best usage of those resources and to consolidate those resources, that really helps to reduce the cost.
Oh, and just quickly, what has this pandemic highlighted about the current supply chain's ability to really adapt in some of these global health emergencies?
There are a couple of different aspects that we can think about. So first one, I think we talked about the shortage of ventilators, right? And so that is one of the big issues in supply chain right now. And so far, we have 160,000 ventilators in the United States. And the stockpiles have 12,700. And according to the forecasting from their, I think from their Johns Hopkins Center and for health security, they are a national needs for up to 700,000 ventilators nationwide in order to handle this crisis. So we are in shortage of 500,000 ventilators nationwide. And there are a couple of different things that's been going on. And of course, the first one is President Trump has invoked the Defense Production Act to encourage GM to produce ventilators. And there are three different kind of combinations we are saying from supply chain standpoint of view right now. So first one, the GM is collaborating with Ventec to help boost up the production efficiency. So what happens in the ventilator industry right now is they have been using the workshop formatting. The production capacity for ventilators nationwide across all the United States manufacturers is tops at around a couple hundred per month, and which definitely cannot supply what we needed. So what we are trying to do from supply chain standpoint of view is to create this marriage to marry mass production auto industries, mass production experience with the workshop type of production process from ventilator industries. So GM is working with Ventec, and Ford is also working with GE Electronics. I think last week I saw the news from CNN, the CEO from Ford forecasted that we're going to have access to over hundreds of thousands of ventilators towards the mid of May. And I'm not sure whether he's very optimistic, but I think if we can proceed along that route, I think we are really going to find a solution. Of course, Tesla is also working with Medtronics. And they're still negotiating the deals, but I don't know exactly how quickly they can get into the production process.
Well, it's certainly encouraging to see. Unfortunately, we are out of time. Thank you so much. David Ding there, Assistant Professor and Director of the Healthcare Services Management Master's Program at Rutgers University.